Welcome to MDNews.com. This is Charlie Milburn. We're coming to you from location at the Society for Healthcare Strategy and Market Development 2010 Annual Conference in Chicago. We spoke with some of the leading healthcare marketing minds on a number of topics, from physicians and social media, physician relations, to a number of things. Take a look at what they had to say.
Related to physician engagement in the strategic plan and subsequent marketing of that plan, it's very important to get them engaged at the very beginning. We have terrific physicians who are very attentive to what we do from a strategic perspective and from a marketing perspective. And so what they want to be engaged and they want to be asked. And what we've learned that has better success than not is to go ahead, work with them, schedule ahead of time, talk to them about what we want, make sure that they understand the major vision of the organization, where we go, what our brand stands for, and then certainly engage them in that process. Sure. Physicians are really great resources for information about consumers. They certainly have a way to practice, and they're very good at diagnosing issues. What they can also help us do is hear directly from the customer what their fears are, what they're concerned about, what they expect from their physician and a healthcare provider. So for us, it's invaluable information as we create any kind of strategic campaign or marketing campaign. We get to hear one-on-one what is really important to those consumers and to those physicians, also a major customer. Well, there's a number of things when developing a marketing strategy that are important. Certainly it's going to be based on community need, and you need to know what your community, what affects your community, what their needs are from a global perspective. What also is important is what your hospital specializes in. Maybe some revenue generating, maybe some not, but really focused on how you're going to propel your own organization vision, grow your market share, be sustainable in your market, and provide those services to the very best ability that you can. Well, healthcare reform, what is it? So we have a sense of what it may mean, but really how we're approaching it is knowing that we're going to be able to provide more services, or we're going to be asked to provide more services with probably fewer resources, and have the expectation and the desire to provide better quality. So that's the premise that we're working on from a strategic standpoint in healthcare reform. What it specifically means is we're focusing on access, how to get these patients into a primary care provider, and then diagnosing them correctly as soon as we can with the right amount of resources at the right time. So that's really how we're approaching healthcare reform today. Certainly that strategy and plan will change as we go forward, as we learn more. I think SHSMD this year has really brought the vendors together in a forum where I have learned a lot. Certainly walking up and down the corridors is very helpful, but the one-on-one conversations about new things that are happening where I don't get a chance to go out and visit all of these great places, they've brought it in one place for me. And I think that's very helpful because it's not often that healthcare marketers get from behind their paperwork, their piles and piles on their desks. So I've thoroughly enjoyed meeting people, talking to people, and learning what kinds of cool things are coming. So it's been very good.
So now that you've heard what they have to say, we want to know what you think. Click on the Share Your Perspectives link on MDNews.com and give us your opinion. Reporting from SHSMD in Chicago, this is Charlie Milburn for MDNews.com.